Live.
He said you're on. You're live, Chairman.
We're live? Okay. Good morning. Thank you, everybody, for joining us for today's staff meeting. Without further ado, we'll hand this over to Manager Tom Stoltz.
Good morning, Chairman and Commissioners. We have 3 items for discussion during today's staff. First of all, we will have a guest speaker this morning to talk about the Stepping Up program, and I'll introduce her in just a bit. This was presented to the CJCC a few months ago, and I think we had a couple of commissioners that thought it would be, Commissioner Cruz and Commissioner Howell both thought it would be beneficial for the commission as a whole to hear this. Then Tim will give the second item is Tim will give an update on vaccine status and kind of where we're at and how many kiddos we've vaccinated in the last week and what the future holds there. And then finally, we need to discuss the tactical plans for next Monday night's town hall meeting. So that'll be the third item. So the without further ado, the Criminal Justice Coordinating Council was given a presentation earlier this year on the Stepping Up Initiatives, which is a national initiative to reduce the number of people with mental illness in jails. As I mentioned, Commissioner Cruz and Howell thought it would be beneficial to have the commissioners hear about the benefits of this program. And so here today is Audrey Goldsmith. She is a senior policy analyst with the Council of State Government Justice Center. Audra provides county-based technical assistance for the Stepping Up Technical Assistance Center, and she is collaboratively supporting and assisting systems and improvement projects. So Audra, you have the podium, ma'am.
Okay. Good morning, Audra, and welcome to the staff meeting. Welcome.
Thank you so much. All right. Thank you for allowing me to come speak with all of you today, Commissioners. As they said, my name is Audrey Goldsmith, and I'm a Senior Policy Analyst at the Council of State Government's Justice Center. I've been there for about 8 months, and previously I was a clinician at Horizons Mental Health Center and worked my last 2 years in the Reno County Correctional Facility. So today I want to spend time talking to you about the Stepping Up Initiative. For those of you not familiar, the Council of State Government Justice Center develops research-driven strategies to increase public safety and strengthen communities. The Justice Center has a long history of working in Kansas. We are on our 3rd JR effort. There are various JMHCP or your Justice Mental Health Police Collaboration communities here in Kansas, and we have worked with various SCA grant recipients in the state. Also, Chief Gordon Ramsey of the Wichita Police Department also sits as a board member for the Justice Center. So as it was said, Stepping Up is a national initiative to reduce the number of people with mental health and co-occurring substance use disorders in local jails. The Justice Center partnered with NACO, the National Association of Counties, and the American Psychiatric Association Foundation to launch Stepping Up in 2015. We began this initiative with recognition that there's this issue of having a very large population of folks with behavioral health disorders in our county jails, and it was very problematic. And counties seem to not be able to come up with solutions to be able to help this issue. So Stepping Up is a data-driven, cross-systems approach designed to meet counties where they are and provide critical support for achieving results. It helps counties to identify their target populations within their jails, select strategies that work, and support scaling those up. It also helps you to gauge the progress towards common systems goals within your community. So how have we come connected? Kansas has been very involved, as I stated, so much so that the coordination with the Governor's Behavioral Health Services Planning Council and the Mental Health and Jails Work Group, as well as KDADS, came to Stepping Up and decided that they would like their own state technical assistance center. This was a recommendation that came forth by multiple leaders within the state, within your behavioral health and local law enforcement. Stepping Up has been around for 6 years and counting. We are actually in over 540 counties across the nation. There are 5 other states across the nation that have their own statewide Stepping Up initiatives, and Kansas is only the second to have its very own Technical Assistance Center, along with Pennsylvania. So as mentioned, it's a national effort to reduce the number of mental illness and co-occurring substance use disorders that are occurring in our jails and justice systems. The idea is to help counties connect cross-systems collaborative teams and utilize data to understand their target populations and identify effective policies and strategies and bring those up to scale and also track their progress. So how do we do this? How do we accomplish this with counties? There's a planning process via these 6 key questions on the screen. We also strive to collect baseline data and then work in progress through 4 key measures that I will touch on in a second. The planning process also includes efforts to identify high-impact strategies. When I say that, I mean what services do we need in the community to help? What's not going on? Where are gaps in services, and how are we going to address those or scale those up? We essentially provide support on how the counties will work through these 6 key questions and also utilize the 4 key measures and start to see results and positive outcomes in their community. We provide resources such as do-it-yourself tools and research analysis. We provide one-on-one trainings, whether that's phone calls or virtuals. We provide group trainings, connections to national experts, connections to data experts, as well as connections to colleagues through county examples. What are counties across the state doing that could be very similar to something you would like to start here in Sedgwick County? But not only across Kansas, what are they doing across the nation that could be something that could really benefit Sedgwick County? Sedgwick County has become a CC, or is working on becoming their CCBHC model within the Community Mental Health Center. And that is something that we can also support. We can help provide assistance on sustainability, provide insight on funding, peer connections with other counties, and giving examples on what other community mental health centers across the nation have done in order to make their services successful. We are also closely monitoring the 988 expansion across the state and can work with counties on what services and policies and procedures they might want to utilize to accommodate and work well along with the 988 rollout. We usually push for data. We strive to have counties have a strong baseline data, and Stepping Up really helps provide those guidelines on how to collect data within your county jails. I previously watched a commissioner meeting here, I think back in April, and Mr. Stoltz mentioned we need to work on a larger scope to help protect and make better services. How are we going to start showing positive outcomes and really having a positive impact on that mental health population in our jails? What's the larger picture? And I think Stepping Up can really come in and be a part of this conversation with Sedgwick County through the one-on-one consultation, through those peer connections, and providing framework and guidelines can really help to try to have positive outcomes and lower that mental health population that can be so cumbersome in our county jail. Sheriff Easter mentioned 30 to 33% of inmates in his jail have been identified as having some sort of a mental health concern. And he also mentioned there was 70 to 72% of folks in his jail have also a substance use disorder. So you can imagine this population, it comes at a cost. We need to provide sources and services to these folks when they are in our custody within the jail. And that cost trickles down. The effects in the community at large, not just the individuals who utilize these services, but also the folks providing these services. Enhancing services in Sedgwick County and reducing the mental health populations in our jails could also have a positive impact on increasing the connections to care, resulting in a healthier community. I have on the screen here some key accomplishments thus far with Stepping Up, but also in the state of Kansas. We currently have 11 counties who have passed a resolution, and we have 3 counties who are identified as innovator counties, and that just means that they are at the forefront of collecting data within their jails, tracking services and outcomes of things that are being applied to folks within this population to see that there is success, to see that they have started to work on that reduction and they're able to see it through their data. I also wanted to mention that Jeff Weibel with Wichita Pd, he's the leader for the for the Law Enforcement and Mental Health Learning Site through the Justice Center. And he's currently working on a project that links counties and peers to learning sites who have been innovated and show progressive ways to collaborate with law enforcement and mental health in their counties. So this is something that's being worked on in the city with PD, with law enforcement, and I feel like this is a good opportunity to bring it to the Sheriff's Department and bring it into our jails to look to see positive outcomes that we can also work on together. We have multiple resources that we provide along with our guidance. These are some of the self-help tools that we provide counties to work through to give them clear frameworks and foundations on how to utilize the Stepping Up initiative within their county. And our first question is your leadership committed? So when creating county leadership structure, it's important to have key players at the table, including folks from mental health centers, your substance use disorder providers, hospital representatives, your crisis directors, law enforcement, sheriff's department, as well as those with lived experience. So for example, the Stepping Up Council that I was able to be a part of in Reno County consisted of their sheriff, their jail captain, their jail mental health team, a district attorney, the defense attorney, a county commissioner, the CEO and directors of the Community Mental Health Center, as well as directors of the community corrections, other folks from the police department, among other people who would like to be present at the open meeting. So in this council, we really work to identify the problems in our jail and in our community related to this population and discussing those observations that our leadership and our administration within the jail was seeing, bringing that back to the Stepping Up Council and working collaboratively with the rest of our high policy stakeholders. And when I say that, those are the folks who can make the decisions. When we're talking about what issues and what services and things we want to look at doing in our county, we have the folks who have the power to say, yes, let's try this. Yes, let's do this. Yes, we'll make the commitment right now. And those plans and having that cross-systems collaboration really has a positive impact on the issues being discussed at the moment. All right, so getting started with Stepping Up. Formally, a county will pass a resolution, and these resolutions are presented to the county commission. I've been told by folks within the CJCC that they are working on currently putting this together and will be presenting this in the near future to the council. Stepping Up is going to continue to work with the CJCC and or a subcommittee that's going to essentially do the Stepping Up work here in Sedgwick County, providing them frameworks, providing them collaborative efforts, and giving them information and resources on how to make this successful in Sedgwick County. We really strive to have elected county officials be involved in Stepping Up, to know what these 6 key questions are and to understand the 4 measures that we are looking at, which are reducing recidivism, reducing the average length of stay for your mental health populations, connecting them to care, and overall decreasing the amount of people that are in your county jails that have mental health concerns. Your insight and support are key for these initiatives, and this kind of cross-systems work is successful only with support from you and other high policy stakeholders. We also really recommend that you do screening within your county jails. And why is this important? You can imagine that if you have a large population of mental health folks within your county jails, there must be a gap in services in your community. What's happening that these folks aren't getting the support that they need, the services, the access, and understanding and analyzing how this is affecting your community? And we use that data from the jail to understand. What is the impact? How big is the problem really in our community? And what services do we need to try to positively impact this? So we really recommend baseline data being collected at the jail. The information that's been shown thus far to me by Sheriff Easter has really been fantastic. They do a really good job of collecting data within their jail. And now conversations can start of how do we make a positive impact on this? We recommend that counties have a shared definition of what SMI is across all systems, corrections, jail, behavioral health, so that we're talking about the same population. And I also wanted to point out that Sedgwick County did go through what's called a sequential intercept mapping project or workshop back in 2020, and it was recommended in there by the Policy Research and Associates that they look at doing a timely screening within their jail, and that they also look at having some sort of a coordinating council, which could also serve as stepping up within the Sedgwick County community. So, any questions at all from the commissioners? I would be happy to answer anything.
Commissioner Cruz.
Thank you so much for being here today. I appreciate all this information being presented for the entire public to see. Are you familiar with the diversion hub in Oklahoma City?
I am not, no.
So last week I went down there, and they have a system in place that helps people navigate the justice system. And as I was speaking to Megan, is her name, she talked about, for the sheriff, like, why are people getting booked? What happens when they're in there? How long do they stay in certain spots? So I'm excited to hear that you've received some of that information. Would you be willing to share that with us?
Yeah, I think as Sedgwick County continues to identify the why, I know that there's conversations of collecting the data and seeing how long people with SMI are being held in the county jail. They collect average lengths of stay. They collect all of this information, and starting to have that conversation through stepping up of what are we doing with this data. What other counties do is they might identify, well, we don't really have reentry services within our jail. How are we going to make a difference and make a change? Or maybe we have reentry services, but it's just a phone call. So what ways can we enhance those services so that we're having a better connections to care when folks are getting out? And that's the kind of conversation that we really try to spark within a Stepping Up Council, is identifying what's lacking in a county and taking that back to your Stepping Up, taking your observations, taking your data, and not just from the jail. That's why community corrections is involved. That's why people with lived experience are involved. And that's why county commissioners and other high policy stakeholders are involved, so that everybody can bring their observations and their challenges and what's going on and take that to the table and have those discussions on how we're going to make this better. So in Oklahoma City, having that diversion, they're able to take what they're observing, take that back to their Stepping Up if they are stepping up. It's a pretty predominant in Oklahoma as well. Taking that back to their council and saying, this is the problem, how are we going to address it as a whole, as a collective, as a community?
Thank you. I'm just looking at your innovator counties on here. You guys have a good amount of info on here.
Yeah. Johnson, Douglas, and Reno County are currently innovators. And with the data that Sheriff Easter and his jail administration collect, and information on how we want to make that better, how we want to have positive outcomes, you guys would definitely be in the lineup to be an innovator. And when you become an innovator county, you're really being a model county. There is a lot being offered in Sedgwick County as far as services in the community, services, your hot team, your crisis stabilization unit, your mobile systems that you have going on, and you can model those for other counties, not only across the state, but across the nation.
Thank you.
Yes.
Any other questions, comments? Commissioner Howell?
Thank you, Mr. Chairman. So thank you for being here today, and I'm so glad you're here. Since this has been going on for 6 years, can we look at some of those early communities and see what their baseline data looks like and where are they today? Do you have that data?
I do, absolutely. Douglas County is a really good example if you're looking state-wide at this. They implemented Stepping Up roughly about 2015 and started collecting their jail data and really analyzing it. And not only seeing that they needed to provide additional services within the jail, but also uplift services in the community. And they started tracking that over time, and they actually have a report that's getting ready to come out that looks at positive impacts over the years as they've implemented different services in their community as a result of having these conversations through their Stepping Up initiative. I can definitely forward that on to the commissioners.
Yeah, I think. Thank you for that. I think
Absolutely.
that'd be helpful for us to help steer us a little bit. Now, one thing you've not talked about is there a financial component to this commitment?
No, there is not a financial component. Again, as the county and as your high policy stakeholders within the community look at what services do we need to implement, it's important to have a commissioner or somebody that can come and assist those meetings so that you understand and and you're ready when you might have people in your community that come and say, we would like to uplift this program here. So things in the future that might blossom out of a Stepping Up initiative could come with a financial cost, but stepping up alone, passing a resolution, and having these conversations within your county has no financial tag on it.
All right, thank you so much.
Commissioner Dennis.
Thank you, Mr. Chairman. Again, thank you for coming and briefing us on this. Your slide about the leadership management structure shows one of our judges, the sheriff, court administrator, probation, behavioral health director, or district attorney all involved in this. Have you had a chance to brief all of these folks, or is this first step?
I have presented to the CJCC, so I believe we had quite a few of those folks at the table, but there could have been a few that were missing. So I would rely on whomever is going to kind of be the coordinator of Stepping Up within Sedgwick County, if this is something you would like to pursue, to start identifying who you're missing at the table and who needs to start being a part of these conversations. This list is not all inclusive by any means. As a county, you guys will decide who you need at the table to help make these decisions as you move this initiative forward.
Okay. And follow up on Commissioner Howell's comment on your question one, the first step is the mandate from leaders responsible for the county budget. So as we move forward in this process, we're going to start the budget in February for 2022. So we'd have to have some kind of idea of what would go into this budget at that point in time. We adopted in August, so we've got quite a bit of time, but we start the process fairly soon. So I don't have a good feel for what would have to go into the budget in order to be able to support this.
Sure, absolutely. Let me give you an example. When I worked in Reno County, our Stepping Up started in about 2015. We didn't have a therapist within the jail until about 2016 or 17, but it resulted after conversations within the Stepping Up Council. And so in order to help budget and help present this to the county, once they decided that they would like to have somebody within the jail, a therapist, the Sheriff's Department and the Mental Health Center got together, discussed the budget, discussed a proposal that they would like to present to the county commissioners on how this was going to be funded. And then at that point, it was thus presented to the county commissioners once they as a group decided on how to move forward with that. So there might not be any additional funding budgeting proposals that come this year from the Stepping Up Council, or there very well could be. But those are conversations that they would have within their own council to what they want to do, where they would like to see funds allocated or maybe redistributed or get additional funds, and then they could present that to you come February. But that's all conversation that will happen within the council and futuristic. Nothing that's set in stone at this point.
It looks like one of your main goals is to help reduce the amount of folks that we have in our jails because they have mental health issues. And,
yes, sir.
That should result in some kind of a budget savings, I would think.
I hope so.
Do you have data that shows how that works out, what kind of savings you could have to offset the cost of the rest of the program?
Absolutely. I bring up Johnson and Douglas County a lot because they have been stepping up for quite some time, and they're also two of our innovator counties. I believe it was Johnson County, but I might be misspeaking. It might have been Douglas County, has done cost analysis research on looking into utilizing and uplifting and starting different services in the community and how that is impacting in a positive manner the cost that jails are having on providing services in-house for folks that live with mental illness. So I would be able to provide you some data on that.
Super. Well, Audrey, thank you very much for being here again. I appreciate it. Thank you, Mr. Chairman.
Commissioner Cruz.
Thank you, Chairman. I did just quickly find the Stepping Up Initiative dashboard on Douglas County's website, so I have forwarded that to all of my colleagues here. And it does talk about, in one of the boxes, about recidivism and percent booked of people with SMI who had been had multiple bookings in a calendar year, and so this is great data. On slide number 11, it talks about, one question is, have we connected the dots between multiple initiatives in the county that address behavioral health in the justice system? So, if they're not booked into our jail, where do they go?
Well, I think what that's touching on too is some folks have a mental health task force council, some folks have the CJCC, some folks also have a SUDS or a substance abuse task force. So there's all kinds of different councils and committees that a community may have. And are those systems speaking? Because they might be doing the same work within each council. And instead of doing the same work siloed, why do we not all do it together in one thing? So to address your question, Commissioner Cruz, when you start looking at these multi-systems within a county, if somebody isn't getting into the jail, but they're high utilizers of community corrections, they can still come to the table and say, this person has been PVing, or we've been having all of these issues. What's going on? What barrier is this person having in their life to not make corrections successful for them? And those are conversations that your leaders from community corrections can bring to the table to figure out how to identify that gap, how to analyze it, and what to do about it. So they don't have to go through the jail necessarily. Johnson County and Douglas County, they have also done what we're calling familiar faces instead of high utilizer studies. And they have tracked, I think it was Johnson County had 4 folks that they tracked over time and looked at cost analysis savings, but the large impact of the study was identifying those high utilizers. What services are they using, and how do we make positive impacts and uplift each of those services so that we're having success across this intercept? And when I say intercept, it's basically all of those folks that if a person was going to have first contact with the justice system, all the way through making it to corrections, through court, and back in the community off paper. So you'd think of all those people in between.
Yeah, so essentially what you're describing is our Mental Health and Substance Abuse Coalition. So we did a high utilizer study of 519 people who have gone through a system for about 3 years. Mm-hmm. So essentially what you're describing is what we do have here. I'm excited for stepping up to add to what we're doing there, because we have to figure out a way for people to stay out of a system that's not really rehabilitating them. Mm-hmm. So I appreciate the work that you've done, and I look forward to implementing it here.
Thank you. I'd be very interested in seeing that report as well.
Commissioner Lopez?
Thank you. I think most of my questions have already been answered so far, but I just really appreciate you coming here and giving us this information. As I dig through this a little bit more, I'm sure I will have more questions. So I see your email address, so I'm sure you'll be hearing from me. But I'm really excited. I mean, this sounds like it's a really good way to go to the next step, I guess. And I think that we could really utilize that here. So I appreciate you being here. Thank you.
Yeah, thank you.
Okay. Audrey, I don't see any other questions. Any other comments, questions for anybody? I don't see any. Thanks again for being here and presenting to the commission.
Thank you so much.
All right. Have a good day. Okay, next up.
Tim will take the podium now, and he has a short presentation on vaccines.
Morning, Tim.
Morning, Commissioners. Tim Kaufman, Deputy County Manager. This will be brief. There has been something exciting happen in the community, so we'll focus on that. Here's a summary of what we've done in terms of vaccinations. 118,000, almost 119,000 folks first doses, and 253,000 doses total by the health department. And our vaccination rate is now at 59.3% for the eligible population, 55.1% fully vaccinated, and then of the total population, 45.9% fully vaccinated. That eligible population number will go down next week because this is based on data from Wednesday, so we didn't have the 5 to 11s eligible really until Thursday, so that number will probably drop. Now, we've done some significant work already with that younger population, and that's really the highlight of what we're doing right now. So the 5 to 11 vaccination was approved last week. We've already vaccinated 804 kids in that age category. We have an emphasis. We've got appointments on Veterans Day. The county is closed, but we're going to have our vaccination clinic open, and we've got most of those appointment slots dedicated to the 5 to 11 population. We know that there are 14,500 doses coming to Sedgwick County this week. The health department received 4,500 of those over partial shipment last week, and then what we received yesterday. But we also know there are a number of other providers in the community that have ordered vaccine, and it's coming to them as well. One of our big partners in the community vaccinating children is USD 259. They're a vaccine provider, so they're able to order vaccinations, and we know that they've done that, and they have the staff and the capacity to vaccinate kids. And so 259 is really going to be taking care of their kids that way. That leaves us the opportunity to work with suburban districts and mobile clinics and that sort of thing. So we are continuing to plan with some of the suburban districts. We've heard from a few. We haven't heard from all of them yet. We're reaching out to them to see if we can be of assistance, if they want us to come on site, or if they've got other plans. But we've certainly got a lot of appointments available on Thursday, and then every day we've got appointments available for kids as well. So I'd be happy to answer any questions you may have.
Okay. Commissioner Dennis.
Thank you. Really briefly, I guess I don't understand the difference between the children's vaccine and the adult vaccine. From what I see on the news, it says that the 5 to 11 vaccine is just a third of a dose of the adult, and yet they package it different. They put different color caps on it and so forth. Are they just giving them a third as much? And if that's so, why does it have to be packaged differently?
I'm guessing the reason that it's packaged differently is for safety purposes, to make sure that they're recognizing that they need to use that lower dose for kids. Again, I think it's a safety issue.
Well, I understand it's got a smaller needle, but the CC, the number of the volume that you're giving, is just a third the adult, correct?
Yes.
Okay. All right. Thank you.
Okay. Commissioner Lopez.
I would just mention that with the measuring piece, Moderna is different than Pfizer, right? And then the boosters are different, and then the pediatric doses are different. So there's so many different measurements that people are having to do that to make it simpler, so there's less possibility of human error, which is obviously, something that happens. That's why they're doing it a little different, just to help keep it a little bit more organized for the people giving the doses.
Okay. Well, Tim, thanks. It's off to a good start, sounds like.
It is, yeah.
Okay.
Thank you.
Thank you. Appreciate it. Okay, next up.
Now let's spend the remainder of the time here talking about the town hall, which is next Monday night at 6:30 at NCAT. I think Tanya will lead the discussion on just how the commission desires to format this event and how we want to run it. So.
Good morning, Chairman and Commissioners.
Hi, Tanya.
Tanya Cole, Assistant County Manager. What I thought I'd do this morning is just do a run-through of what next Monday's redistricting town hall will look like, and then if you have any suggestions for changes, we'd be happy to implement that. So that is next Monday, November 15th at 6:30 p.m. at NCAT, and we will have that in the lecture hall. So prior to the meeting, before and after the meeting, we will have on display the current district map, and then we'll also have the proposed redistricting maps on display for the public to view those, again, before and after the meeting. Then at 6:30, which is when the meeting will start, we'd like to have the commissioners seated on the floor. We'll have 2 large tables there, and we'll have mics set up for you all. Mike Fessinger, Assistant County Counselor, will go over the redistricting overview as he did at staff meeting. And then once he's done, we will have Jack Joseph, GIS Manager, go through each district map and kind of explain each map, the current map, and then 8 maps that we've discussed last time, and then any new additional maps that each commissioner has proposed. And then we will allow the public, if they have any questions, to ask those questions, and we will be on hand with microphones to pass those around for the public to ask those questions. The meeting will be live on Facebook and YouTube, so if the public are not able to be in attendance, they'll be able to watch that meeting live. And so that is our run-through of the meeting. So if you have any suggestions that you'd like to implement for that meeting, be glad to hear those and implement those for you all.
Okay. Tanya, come to a couple of things for me. Since I was able to witness the Wichita meeting of the state when they did their tour, they stopped in and they had a number of people come up to address. They had a time limit, which I think it should be related just to redistricting. A lot of the people that addressed that committee were talking about many things other than redistricting. So I'm hoping that we can have comments related to what this special meeting is about related to redistricting. But that's something we can announce more at the beginning. The other thing I was wondering about, since we're going to have the maps out, I don't have any idea how many people may show up, but could we do a thing where if a citizen likes this map, dots, green dot, I like this one, red dot, I don't like that one, and not that it's anything officially scientific, but it might provide us some visibility. If there's only a handful of people show up, I'm not sure how relative it would be. It's ultimately our decision anyway at a timing to be determined still. So, but those are just my two thoughts. Was the comment period? Tell us what you feel, and then maybe a dot poll if that's okay with the rest of the commission. Any other comments from commissioners or questions? Commissioner Lopez?
Should we have someone from, has all of our advisory boards looked at the maps so far? I think
Mine has,
probably.
yeah.
Should we try and get someone from each of our advisory boards to come up and maybe say what their thought was, so we can just hear from all of the advisory boards as well and not just our individual one? Would that be
Sure.
helpful? I mean, is that something we should?
Absolutely.
Okay.
Commissioner, would you like to put that on the agenda then, to have a representative from each DAB board come before the commission?
I don't know if it would need to be on the agenda,
Okay.
but I mean, just an idea for everyone. I'll ask, I have my advisory board tonight, so I can ask them if someone wants to come speak. And I mean, you guys can handle it however you want to handle it,
Okay.
but yeah, thank you.
Yeah, our board looked at it and kind of, first time, I mean, they look at it, I'm not sure that they have consensus either necessarily, but, because it's kind of overwhelming, the 8 maps. It'd been easier if there was 2 or 3, but.
Mike said a few they didn't like, but that was.
Right. There might be more opinions about what they don't like than what they do. I think you're right. Commissioner Dennis.
Just really briefly, are we going to have the portal open so that they can make online comments like they do before our board meetings?
Actually, that's a great idea, Commissioner Dennis. We'll work towards having that available for this meeting.
Okay, thank you.
Okay. Commissioner Howell.
Thank you, Mr. Chairman. I guess I would like to, I'm not sure the dots is my preference. I would like to have someone fill out, maybe a comment card, provide their address, we know where they live, because I'd like to know if they have how are they being impacted by this? If they live in District 5 and they have a strong opinion about a map that only impacts Districts 2 and 4, I guess I'd like to know that. But I think that knowing their address and any comments that they would have, I would like to see this be more information than just a colored dot on the map. I think it would be,
That's fine.
I'd like to understand more the perspective, I guess, deeper than just the dot, so,
That's a good point. Yeah.
thanks.
Yeah, maybe just comment card. And I'm not sure they even need to put their name as much as their address. Is that right, Commissioner? Yeah, but address to let us know. Well, that's a good idea. Any other questions, comments? Okay. So 6:30 Monday.
6:30 Monday.
Okay. All right. Thank you.
Okay,
I don't
thank
see
you,
any
Commissioner.
questions.
We'll implement those suggestions.
Okay.
Okay.
All right. Tom?
That's all we had, Chairman.
Okay, a reminder that tomorrow our meeting starts at 8:30, so, right? Go ahead, Commissioner Dennis.
Real quickly then, when are we going to vote on this, on the redistricting? When is it going to come up on our agenda?
Well, it's entirely up to the 5 of you. This is a part of the process that maybe after next Monday night, you'll have a better feel on what some of the different Citizens Advisory Board people think, what citizens think. But ultimately, you need to just tell us when you want it on the agenda to vote. And then you pick a map.
And you had said, Mike, you had said at one time it could be December and could even be January or something like that? Is that what you said?
I prefer to do it before the end of the year.
Before the end of the year is
Never
your
done it
preference?
After the end of the year prior to this, but,
Yeah, all right.
yeah, I mean,
Okay.
actually, 10 years ago, just because there was an error in the map, some of the precincts were left out. The final map was actually in December, but adopted. But it'll be, I think, easier this year with all the technology we have. We'll draw a resolution up with whatever map you guys decide on, and then it'll have all the precincts as backup, showing how they fit into all those different districts.
Okay. Commissioner Howell?
Thank you, Mr. Chairman. Just so besides our meetings that we have here, we've talked about this, I think, 2 or 3 times in our meetings here. I think it's been on our newsletters. Besides that, how does the public know that this is going on? How does the public know that this is an opportunity? Have we communicated on anything other than just those 2 formats? I mean, my CAB board got involved because I asked them to, and I guess my perspective is it seems like there's been very little interest from the community so far. I'm just wondering if they're not aware or they're indifferent. I don't know.
Not really sure about the sentiment of the community commissioner. However, we have put this on social media, all of our platforms, Facebook, Twitter, Instagram. And then we've also had staff available at each CAB to talk through it. And then our media partners as well have picked this up, Commissioner. So it's actually been on the news. So we've done everything as far as communication to reach the public. So if there's something different we can do, we'll definitely do it.
I don't know. I just don't want to get to the end of this and find out there's people who say, I didn't know, and y'all didn't do enough to communicate, because that's Tim Steck. That comment happens once in a while, and trying to avoid that this time. So if there's anything we can do to make sure we communicate better, we need to know what that is. All right, thanks.
You bet. I've tried to get my memory cap on 10 years ago. In 11, I was on the city council redistricting, and it was a lot of discussion among the members, and you're right, I don't think there was a whole much of public interest, but there should be, but I don't know that there is. So,
Well, just for point of reference, mine got taken over by the courts.
well, I know
10 years ago.
I know, and that was I think as long as we're legal in
Well, politics.
Fire.
It's interesting the politics that happened behind the scenes on that. I could talk about this for an hour. It was very interesting to see how really the members of the body really got along really well, but the 2 bodies didn't get along with each other, and that's really what, in my opinion, caused the impasse. And the courts set a deadline, and it was somewhat abbreviated, in my opinion. So ended up in the courts, I thought, fairly quickly. The process didn't work its way to the end of the session like lots of other things do. Obviously, they could not have adjourned the session until this was complete. But rather than working out their differences, it got taken over to the courts. And so I don't know if there's it seemed like there was arbitrary pressure to get to a conclusion. And again, I have, in my mind personally, if this takes till January or whatever, I'm fine taking as long as this takes. I'm not in a hurry. If we want more time or need more time, let's take the time. I'm not, to me, this is not an arbitrary thing. We shouldn't just set a deadline and say, let's be done by this date. But, and if we have if we can't find an agreement amongst the commissioners for some reason, I think we can continue to work at it. That's my opinion. We don't have to have a date that we have to do this. So, I mean, eventually, yes, but not. It doesn't have to be
Right.
November or December necessarily. Thanks.
Okay, and I'm reminded that communications it's in the website, it's on our newsletters, they're going to send out more information. And also a reminder that Friday at 9 o'clock is the canvassing, the Board of Canvassing for the recent election, of which the commission is the Board of Canvass, and if they can't make it, they've assigned a proxy representative to serve in their spot. That's 9 o'clock Friday, and that's open over there at the election department, or the election office. Any other, what?
There's another one after that.
Right. Okay. I don't see anything else. No other comments? Okay, thank you, everybody, for being here. See you tomorrow at 8:30.